Hello, my name is Faustina Ikizi, and I am a nursing student from Indiana State University. Today, I will be presenting opioid abuse and overdose. This is my health education program from our 444 Community Health Nursing class. The population at risk for this presentation are African American adult, age 14 to 40 years, history of drug and alcohol abuse, untreated mental disorders, unemployment, low educational attainment, and low income community. Please take a moment and click on the pretest to test your knowledge on this topic. At the end of this presentation, learners will be able to recognize the signs and symptoms of opioid overdose and withdrawal, identify causes, risk factors, and barrier to early intervention and treatment of African American community. Be aware of long-term and short-term effects of opioid overdose. Demonstrate awareness of the opioid epidemics and available options for prevention, treatment, and recovery. And this presentation will inspire healthcare professionals to engage in the opioid epidemic research and to develop culturally appropriate treatment plans for target group. Let's talk about a general review on this topic. Opioids interact with opioid receptor on nerve cells to alleviate pain and create a pleasant sensation. It is approved for the treatment of moderate to severe pain. Opioid effects can motivate the person to repeat the behavior, leading to increased tolerance, dependence, addiction, overdose, and death. Opioids are categorized into opiate, semi-synthetic, and synthetic. Opioids may be swallowed, smoked, injected, and inhaled. Most used prescription opioids are oxycodone, hydrocodone, morphine, and fentanyl. Fentanyl are synthetic, however, drug trafficking in fentanyl has increased in many areas. Statistics shows us that in 2019, almost 70% of drug overdose deaths were caused by opioids. And heroin is an illicit opioid that kills over 40 people each day in the United States. Black adults are gradually increasing synthetic opioid abuse, probably due to its availability and affordability. It is estimated that about 4% of non-Hispanic blacks are addicted to opioids. Maryland is the leading state in most African American adults with opioid use disorder. While whites consume more opioids than blacks, blacks have seen a greater rise in opioid-related death. How do we know when someone is misusing or diverting their prescription medications? A patient who needs frequent medication refills and have dramatic tales about medicine being lost or stolen, and constant calls to prescriber or visit to the ER requesting prescription for various physicians and resisting other means of treatment. Generally, opioid abuse victims show lack of coordination, sudden weight changes, and deteriorated physical appearance. Stealing opioid medication, especially healthcare workers, are obvious signs of opioid abuse. Signs and symptoms of opioid overdose. Generally, overdose victims may have impaired coordination, sleep snoring with gargling sound, slurry speech, constricted or dilated pupils, and throwing up. Overdose result in loss of consciousness, slow breathing, low heart rate. Overdose symptoms require emergency care lest they could lead to death. What are the causes and risk factors? Negative influence from their social life, social cultural factors, family and friends. History of physical and sexual abuse and mixing drugs like benzo, alcohol, and cocaine. Also, genetic factors and chronic stress. Recognize that selling or consuming drugs is a way of survival for many in impoverished and low income areas, and opioids are not the first or only drug taken. Poor mental health and past substance abuse are common triggers for overdosing and abusing opioids. Opioid withdrawal symptoms include a broad variety of symptoms after quitting or reducing opioids. Opioid withdrawal can cause anxiety, restlessness, running nose, pupil dilation, nausea, vomiting, loss of appetite, confusion, chills, increased blood pressure, heart rate, respiration, and muscle and joint pain. Prevention. States, counties, communities, and individuals all have a role in reducing opioid overdoses. Most importantly, while developing and implementing these approaches, ethnicities, cultural, language, and economic obstacles should be considered. The first approach, anti-opioid messaging and community outreach. Barbershops, beauty salons, and churches are vital in setting Black and African American communities for providing preventive information and connecting to treatment. Additionally, need for education. Using of faith-based groups, teachers, parents, and healthcare providers have crucial role in educating people. Increasing MOT, medication-assisted therapy, distribution in the African American community will save countless lives. Increased access to treatment for other substance use disorder like cocaine is critical. Therapy and counseling are vital for African Americans, including easy access to therapy for other drug addiction like cocaine. This program helps them find healthy coping strategies. Also involving Black community in the criminal justice system, we assist create more culturally tailored initiatives. Implementation of federal and state laws such as supply and demand laws and time and dosage law. Healthcare professionals must inform patients of limitations, review outdated data, and contact other physicians and follow CDC guidelines. Patients must disclose to healthcare professionals any prior prescription acquired, ensure safe drug storage and proper medication disposal, and avoid using opioid alongside alcohol and other drugs. Effects of opioid abuse and overdose. An overdose of opioid can cause drowsiness and unconsciousness. Abuse that leads to addiction mainly causes withdrawal, particularly after the drug influence decreases in the human system. Major causes of overdose death with opioids are severe respiratory depression. Long-term effects can be lung disease, heart disease, cancer, mental illness, HIV/AIDS, hepatitis, coma after an overdose, and eventual death. Also, abuse and overdose can result to lower educational achievement, unemployment, housing instability, damaged relationship, and criminal justice involvement. What are the available treatments? Despite the challenges in opioid use disorder, treatment is available. The main method is medication-assisted treatment. Medication addresses the physiological implication of addiction, but psychotherapy resolves mental and emotional problems leading to opioid addiction. Additionally, psychosocial support should be part of the treatment and recovery program. Psychosocial support is necessary during treatment, recovery, and the rest of one's life. This form of support maintains sobriety. Furthermore, abstinence after detoxification is a form of effective treatment if the patient are disciplined and have adequate support. Management. The most basic measure is creating awareness against opioid abuse, encouraging positive social influence, engaging in constructive activity replaces idleness that could lead to opioid abuse. Additionally, self-care plays a major role in emotional and psychological health and rehabilitation, like the 12 steps is also widely used to manage opioid abuse and overdose problems. The goal is to use management strategies to avoid relapsing into addiction or abuse or prevent drug abuse problems from developing. Barriers to care. Among the barriers of care and treatment for opioid use disorder include stereotypes, stigma, and racism. African Americans are significantly vulnerable to these vices. For this reason, they are reluctant to seek treatment and continue struggling with opioid addiction. Another hindrance is treatment costs. Low income earners in the African American community cannot afford insurance or money for treatment, so they remain vulnerable and eventually lose their lives. Lack of adequate support within family and society is yet another reason for low rate of treatment in the Black community. They experience inadequate community resources, which aggravate the problem. Please click on the link for pretest answers and click on the handout link for more information. And here are my references. Thank you for watching.